You're not sorry. Okay, thanks for coming tonight. Something recently happened to a friend of mine, and it prompted me on the subject that I wanted to talk about tonight. And I think you know her. Her name is Martha, and I work with her. And recently, Martha's mother spent a couple weeks in the hospital. She was admitted on a Sunday, and when she was admitted, the doctor told her that on Wednesday, a specialist was coming, and he would set up an appointment, and she would see this man. He would know more about her condition. And she was relieved because she'd gone to this man before, this doctor, and she had a lot of confidence in him. So she was anxiously awaiting her appointment. And Martha decided that she wanted to be there for the appointment too. And I told her, if you need to take off time and you need me to flex around with work, let's get that done. So on Tuesday, she went and asked at the nurse's station what time on Wednesday the appointment was going to be. And they didn't know. So they said, you better go down to the outpatient clinic. They'll know what time the appointment's going to be. But they didn't. They didn't know anything about an appointment. So they gave her the doctor's 800 number, and she called, and then she went to work, and they called her at work, and they didn't know anything about the appointment at all. So Martha made the appointment for her mother to see the specialist, and it was a very, very good thing. She had been very persistent for her mother, and this specialist only comes to our community once a month. So if she hadn't have gotten to see him, Martha would have been driving her down once she got out of the hospital. The second thing was, when he did see her on Wednesday, he immediately changed the treatment she was receiving. And if he wouldn't have seen her, that would have been delayed, and her healing process would have taken a lot longer. So Martha was a very good advocate for her mother. And now she's at home and she's improving every day. But this story that I just told you prompted me to think about something that I already knew, that we need to be an advocate for ourselves and for our loved ones in our health care. If you have a child or an older family member, you need to be an advocate for them too. So tonight I'm going to encourage you and urge you to be an advocate for yourself when it comes to your doctor's visits. Now, your doctor knows about medical care, but you know about yourself. And your doctor might have more than one option for you when you go to see him. But if you share with him a little bit about yourself, your values and your beliefs, he can probably find the best option for you. So let's think about, first, what are the reasons that we might be seeing a doctor? Well, we might have something that suddenly popped up, a new symptom or a problem. We might be following up on a problem that we had before. We might be being sent to a new doctor, or going for an ongoing health problem, or taking a child for a healthy child appointment, or just going for a regular checkup. Well, the Center for Disease Control tells us that every year in this country, there are 1.1 billion visits to doctors' offices, outpatient clinics, and emergency rooms. And the most frequent reason for going to one of these places is a general medical exam on a doctor's visit. And I thought this was interesting, the most common thing that was found was hypertension. So whatever reason you have for going to see the doctor, first you need to prepare. And one of the ways you can prepare is by making a list of the prescriptions that you take. And I've got this bag of drugs here. And if you want to, you can just take your prescriptions to the doctor just like this, or you can make a list. But when you go, make sure you tell him not only the prescriptions that you take, but over-the-counter drugs, and if you take any vitamins or things like calcium, eye drops that you might use. Also, if you have a medical insurance plan that pays for prescriptions, you will want to take along the formulary from that plan. And I'm going to stop here for just a second, and then we'll start the tape up again. This is beautiful.